like, where we're going to be at in a week's time. And again, we're going to review all this information, and there's lots of information to review, including the Delta variant, including experiences in other jurisdictions, to come to some of those decisions, and that'll be available next week.
All right, thanks for that. And my follow-up is, can the province, even if we hit this 75-25 thing or 70-25 thing, and our numbers show what they show, if we still have 15, 20 people outside of the province in other ICUs, and this is again another kind of hypothetical, but is it possible that those July 1st, even if they are subtle reopenings, won't happen because there's still, obviously a big strain on ICUs?
Yeah, first, I do want to thank our neighboring provinces for helping us out with the ICU situation and taking on those clients. We had 57 people who went out of province. 7 passed on because of their ICU admission related to COVID. We had 30 people repatriated back, and we still have 20 out of province. We know when you get into an ICU, you're sick. There's always a risk of death going into ICU. That number is roughly, 30% when you're dealing with COVID. Coupled with that, when you get into ICU, some people have a very short ICU stay. Some people have a mid-term ICU stay, and then we have those long-term ICU individuals who are in there longer than 2 weeks. If we still have people out of province, we're not using that as a single indicator saying we can't do anything either. I think we still have to look at, are we having new ICU admissions, and are we still sending people out of province? What's our hospitalization rate? What's our test positivity rate? What's our case numbers? What's the risk in Manitoba as well? So again, it's one of the indicators we look at, but we have to also understand some of the, the metrics and the variables behind that one indicator, but we have to incorporate it into a whole package as well. So again, that will be taken into account when we look at the orders. And again, once information is available, we'll provide that to the public.
From CBC Radio Canada, Charles.
Hi. So, like some of my colleagues said, 11 physicians called today for a better reopening plan with the growing threat of the Delta variant. So, what do you think about their letter? And do you think you will listen to them and maybe adapt your plan to focus more on case numbers and test positivity rate?
Yeah, I think I've kind of talked about this question a few times already, but again, we're going to look at all of our variables. We're going to consider the Delta variant. We're going to look at not just 1 or 2 variables. We're going to look at acute care system capacity. We're going to look at ICU capacity, hospitalizations. We're going to look at case numbers, test positivity. We're going to look at how much Delta variant is out there and other variants of concern as well. And we're going to look at other jurisdictional information as well. And there's a whole gamut of information that we look at, and we synthesize that information and put it together, and we review it with our stakeholders as well internally, including the acute care system. And then, once we have more information, we'll provide that information to the public, and that would be available next week.
Thank you very much, Doctor. And Minister, a new Winnipeg Free Press and Probe Research poll shows that your government approval is decreasing significantly. What are your thoughts on that, and what message does it send to your government?
We know that it's been a very challenging time for Manitoba, for Manitobans, and that is why today I'm happy to be here to provide a bit of a framework for reopening some childcare centres and some of those summer camps, so our kids and our families can have as best of summer as possible. But undoubtedly, it has been a very hard time for Manitobans, and we certainly sympathize with all Manitobans who have struggled through this pandemic. And as a government, we're here to help facilitate and get back to a new normal as soon as possible.
From CBC Manitoba, Jill.
Good afternoon. Dr. Atwal, why is there a Pfizer slowdown or shortage, and will the province hold or prioritize Pfizer for 12 to 17-year-olds for a second dose since that age group can't get anything else?
You know, the Pfizer shortage, again, vaccines procured by the federal government. I believe there was a supply issue there on that side. A vaccine task force would have more insight or a lens on that. In relation to doses and availability, again, you know, the vaccines are interchangeable. Once your dose is available for those 18 plus, whether it's Moderna or Pfizer, get that product. The Pfizer is the only one that's recommended at this point and authorized for those 12 to 17. So again, the first doses are there. You know, our supply issue is a short-term issue from what it sounds like. So there should be enough availability for second dosing when that second dose time comes for those 12 to 17.
And then with respect to the Delta variant, how long on average is it taking to sequence and confirm a sample? And why did it take more than 2 weeks for the province to confirm the first death related to Delta?
So when a test becomes positive, a screen is done, and if those screens show up, let's say an alpha or a beta variant, then you know that's reported out. Once that screen's done, if something doesn't screen in for one of the screened in variants of concern, then we send that off for sequencing. So that sequencing could take 7 days time, 9 days time from when the sample was taken from the person, because the screen has to happen first, and then it gets sent off for sequencing, and the screening could take 24 to 48 hours depending on where it's being done. So there's a bit of a time lag there as well. Now, the second question you had there was related to the death. So when someone has a COVID infection, obviously they get swabbed, they get screened, and then if that screen is negative for a variant of concern that we could screen for, then it gets sent off for sequencing. And then if that person subsequently passes on, what happens is that there's a bit of an investigation there done and a review done to determine if that case actually did succumb related to a COVID infection or not. So that just takes time. And we've had the same experience before as well when we dealt with this as well. So it just takes a bit of time for that to happen, because that review has to happen, typically with the physician reviewing the case and the case file and gathering that information and providing that information.
Our final reporter this afternoon from the Canadian Press, Steve.
Oh, hi, Dr. Atwal. I know you've been asked this quite a few times. I'm going to try it from a bit of a different angle. The letter signed by the 11 doctors today, they spoke about it today, and some said it would be completely irrational to ease restrictions as of July 1st because they don't see the indicators, although they're falling, they don't see them falling to the point where it would justify reopening as early as July 1st. So what do you see in the numbers at this point that would warrant even some easing of the restrictions?
Yeah, so, we work with our acute care system. We talk to the leads on a regular basis. We sit at tables with people who represent all of these doctors as well. And we have discussions. We have discussions with the acute care system on a regular basis as well. Again, when we're looking at these indicators, our case numbers are decreasing. The percentage of individuals who are vaccinated with one dose keeps increasing. The oldest individuals, those percentages are still increasing as well. So the ones who are greatest at risk of entering an acute care facility are on a week-to-week basis. There's more and more of those individuals getting their first dose. And now we're seeing a lot more of them getting their second dose as well. So that's just going to continue. Again, the more individuals that get vaccinated, the less risk there is of transmission, the greater chance there is to prevent transmission chains from occurring as well. So again, we're gonna review all that information that we've spoken about already, and we're going to continue to make the best decisions for Manitobans. And obviously, we always take into account that acute care system as well, and the capacity of the acute care system in our decisions.
And the plan obviously has not been finalized, but what was floated out there in general terms in the 4-3-2-1 reopening plan talked about 25% or greater opening capacity for businesses, services, and facilities. So I'm not sure what facilities means, but it raises the possibility that movie theaters and casinos and museums and facilities that have been closed may reopen. Do you see the public health order changes being that dramatic? Or when you say they're going to be subtle, is it something more subtle that would not include reopening facilities that are currently closed?
Right, so, we've spoken about this as well, so we're going to take into account all that information. The plan isn't a direct correlation with, once we hit this target, everything's able to open at 25%. We still have to look at risk, we still have to look at other indicators as well, and we have to look at priorities for Manitobans. So again, all that information will be taken into account, and we'll review it, and then we'll come up with the best advice for Manitobans, and again, that information will be provided next week.
Thank you, Minister. Thank you, Doctor. This concludes our media briefing.